Some months ago, I received a call from our Chief Executive, Jeanette Oliver, about an inquiry from a former President of the Vascular Society, Adrian Marston, who was very keen to put down on record his recollections about the foundation of the Vascular Society. And it gives me great pleasure to introduce Adrian, who's come to our new offices here at the Royal College of Surgeons to discuss the beginnings of vascular surgery here in the UK. Adrian, would you like to just give us a background of where it first started?
Thank you, Julian. Thank you very much for the invitation. Great privilege to be able to talk to you in this way, and I appreciate the setting up of the video. If I may, I'd like to go right back before vascular surgery, just to create the background, because when I started surgery, although many, many years ago, there wasn't any idea of reconstructing an artery. Arteries and veins were things that were in the way of the surgeon. What you did with them was to tie them off and get rid of them. And it wasn't until really the 1950s that people really started to consider reconstructing blood vessels. Now, I'm not quite sure why that was, because there were two people, one Spanish, one French, both of them lived in the United States, who really had set up the foundation for arterial reconstruction. And the first one was Alexis Carrel, who, by developing the technique of triangulation, suturing arteries, was given the Nobel Prize in 1912 for that work. And the other one was Rodolfo Matas, who was the first one to treat an aneurysm restoratively by opening it and suturing all the branches from the inside, the operation of endoazimuthorrhaphy. So that was the background. And I wonder why wasn't it taken care of? Why was it profited by? And I think the answer was that two things were missing. The first thing was the arrival of water-soluble, heavy molecule contrast media, whereby the vascular surgeon could be shown a map of the arterial system. The gastroenterologists had their barium, and the chest physicians had their Lepalmo, but the vascular surgeon didn't have a map to plan his approach. That was a huge development. And the other one was the development of easy reversible anticoagulation, heparin, because in the days of Carrel and Matas, when you occluded the artery, of course, the danger was the whole thing thrombosed. And the introduction of reversible anticoagulation opened up the whole field. And this stimulated people in the United States and France, and later in this country, to take hold of vascular surgery and create a body of people interested in its development. And that was the origin of the inaugural meeting of the Vascular Surgical Society, as it then was, at the Middlesex Hospital, which is my hospital, in fact, in November, 17th November 1966. And there were 32 invited members, and 29 of them turned up. And they came from all over the country, quite a lot from London, from Edinburgh, from Dublin, from Leeds, from Manchester, from Birmingham. And we got together and formed the Ideal Society. I might just mention one person who was not there, Professor Michael Boyd in Manchester, because Professor Boyd was firmly of the opinion that there was no future whatever in reconstructing arteries. And he wrote a paper in the British Journal of Surgery, good mathematical argument, proving that arterial reconstruction was a total waste of time. So he wasn't there. He's represented by Ken Bloor, who was the senior lecturer in Manchester. So there we were, and the object of the society was the development of vascular surgery, and the membership was decided upon. The president was elected, Mr Sol Cohen, the secretary, James Gillespie, and the annual fee was set at 2 guineas a year. So perhaps I should stop there and I've talked long enough, I think, as an introduction.
One of my recollections, certainly when I was writing my thesis, was the issue of European vascular surgery and the use of sympathectomy, which was propagated by Riche. And I do remember that Jean Cunlin, I think was one of his junior partners, was left alone to do or to treat a patient with severe peripheral arterial disease. And in fact, what he did was to do the first fem bypass using vein.
Absolutely right, yes.
So I think that was also another important step forward in vascular surgery, certainly in Europe.
It certainly was. Le Riche, of course, was from Lyon, and he's commemorated by the Riche syndrome, which is with aortic occlusion, a combination of fine buttock claudication and impotence, and that his name is still given to that quite important syndrome. Canler worked in Paris, and he was a disciple of Riche, but you're absolutely right in saying he was the first one to realise that the venous vein taken out, reversed so that the valve was pointing the right way, was a perfect bypass, and that was the first one, 1948.
And do you have any memories of when the first bypass was done in England or in the UK?
I don't know. I can't tell you that. I mean, Frank Cockett was one of the very first people in London to operate seriously on the femoral artery, but I can't say that he was the very first. No, I can't say.
Yeah. I mean, even in my own readings, I can find no record anywhere where we have information about the first bypass in the United Kingdom. Interesting. So when we were moving our offices in the last month, we were able to do a bit of cleaning out, and we came across the minutes for the first meeting back in 1966, and here it gives you the a single A4 page of the founding members of the Vascular Surgical Society of Great Britain and Ireland, and there are a series of minutes which talk through the process at that time, and interestingly they have the programme, and essentially it's all focused around surgery of the femoral artery, particularly the common femoral artery, the profunder femoral artery, and emergency surgery. So those were really the very early first stages in vascular surgery in the United Kingdom. In addition to that, we've also found the members signing in book. We don't have it for 1966, but we do have the first page for 1967, where the AGM was held in Edinburgh.
So that was the first meeting of the society, and we appointed the president and secretary. And the next meeting was in Edinburgh with Archie Macpherson as president. And then the next one after that was at Hammersmith Hospital. I must mention Peter Martin, who is a surgeon at Hammersmith and also at Chelmsford, because he was the great proponent of reconstruction of the profunda femoris. He was one of the first people to recognise the tremendous importance of that rather neglected artery, because as a medical student who dissected the leg, we don't bother about the profunda femoris, because it's a very important vessel. And then we went on and had a meeting in Glasgow, at which point I was appointed secretary and treasurer. Having no head for finance, I managed to relinquish the treasury post and just continue as secretary for the next few years. And then we went to Dublin, and Paddy Fitzgerald, the president there, gave us a wonderful Irish reception, a fantastic social occasion, and a very good scientific meeting too.
Things have clearly not changed.
I don't think they have. I don't think they have. You mentioned, Julian, that the first meeting was entirely focused on surgery of the femoral artery, but of course, over the next few years, the scope widened, particularly the carotid reconstruction. And Felix Escott at St Mary's is disputed, actually, but I think he has a valid claim to have been the first to do a carotid endarterectomy for recurrent ischemic attacks. And that we went on to explore possibilities of the renal artery, and my particular interest was in the mesenteric circulation. When I was president in '85, my presidential address was around that particular problem. An important political development, and I can't give you a date on it, was the formation of the Vascular Advisory Committee, whereby a surgeon who was applying for appointment to an NHS hospital as a vascular surgeon, the appointments committee had to have a representative of the Vascular Surgical Society there. And that was an extremely important political step for our society in the control of consultant appointments. I think perhaps I should stop there.
Well, it's interesting because now, in fact, what happens is that for all new consultant vascular posts in the United Kingdom, they're sent from the college to the Vascular Society to be ratified. And I think that's been a very important step forward, because it's ensured that the jobs that are put out there for advert are fit for purpose. And certainly over the last few years, we've been able to encourage the development of posts that enable people to do endovascular surgery. So useful step forward.
Indeed.